Hi, I am here today to give my patient Cipro plus hydrocortisone ear drops. My order is for 4 drops to the left ear twice a day. Cipro 0.3% ophthalmic drops, 2 drops to both eyes every 4 hours while awake, and a nitro patch to the chest wall on at 8, off at 2200. What's 2200? 10 o'clock. So what I would do prior to going in to see my patient is take a look at the orders, get my meds, do my first check against the MAR with the medication, and all of my supplies that I need, along with clean tissues, and then all the meds, and then go in and introduce myself. So now that I've done my checks, I'm going to go in and identify the patient and instruct the patient what I'm going to do and go from there. All right, so knock, knock, knock. Hi, I'm Brianna. I'm going to be your student nurse for today. I'm going to be giving you a couple medications. Let me pull the curtain for privacy. All right, and could you tell me your name and date of birth?
Jason Smith.
And your date of birth?
February 16th, 1979.
All right, perfect, Mr. Smith. So I'm going to be giving you, your doctor has prescribed you some ear drops, eye drops, and a patch, a pain patch. Does that sound about right?
Yes.
Okay, perfect. And your left ear is the one that's been bothering you?
Yes, my left ear.
Okay, so that's exactly what the order's for, and the eye drops are for both eyes. I'm going to start with giving you, just putting the patch on your chest. That's for the pain that you've been experiencing. Do you have any other patches on anywhere else?
Not at this time.
Okay, I'm just going to take a look, make sure that there's no irritation anywhere. We'll put it on the right side of your chest. I'm going to take your blood pressure beforehand. I want to take the patient's blood pressure beforehand because it's a vasodilator and we want to make sure that his blood pressure is within normal limits. So I'll start off taking your blood pressure. We're going to pretend that I took the patient's blood pressure. It was actually 120/80, so he is good. I'm going to go ahead and take a look at his chest. And if you could just sit up for me. I just want to make sure that you have no patches on your back. Everything looks good. Great. All right. So I'm going to go ahead and wash my hands, put on gloves, and I'm going to go ahead and clean the site. So the site's nice and clean. Good. I have my gloves on. And we have our patch here. So sometimes this could create some dizziness, so you just want to be careful getting up and down out of bed slowly. So if you're laying down, slowly sit up, and then slowly get out of bed. All right. And this will come off tonight. So we're going to put that right on there for you. And if you start to experience any burning or itching at the site, definitely let us know. I'm going to go ahead and initial date and time. Perfect. All right, so your patch is on. Everything feel okay?
Yes.
Okay, great. So we're going to move on to your eye drops. So it's 2 drops in each eye. Let me change my gloves, wash my hands again. And I had just finished documenting that I placed the patch on his right chest. So now we're going to move on to the patient's eye drops. It's 2 drops in each eye. If this was real, I would go ahead and wait 5 minutes in between each drop, and then I'd instill the next drop. So I have my eye drops. I'm going to go ahead and check it again to the MAR, make sure that I have the right medication. So that's Cipro, 0.3% ophthalmic drops. That's what I have here. And it is for Jason Smith. All right, so we're going to go ahead. I'm going to take a clean tissue. I have new gloves on. And I'm going to ask you to look up for me. So with my non-dominant hand, I'm going to hold the conjunctival sac down, ask the patient to look up, and place one drop in his eye. And I would wait 5 minutes after asking the patient to close his eye gently. I'd wait 5 minutes and now instill a second drop. And you can close your eyes gently. Now with a new clean tissue, I'd go ahead and do the same thing on the other eye. Into the conjunctival sac, if you can look up for me. Put one drop. You can close gently. And 5 minutes later, if you can look up for me, and into the conjunctival sac, the second one. And you can relax your eye. Good. How's that feel, okay?
Yes.
Do you need a tissue?
No, I'm okay, thank you.
Okay, great. So, I'll go ahead and document from here. And lastly, I am going to do your eardrop. Or your eardrops, actually. So, that is 4 drops into the left ear. As far as the eye drops go, any burning or itching in the beginning is normal. If you have a little bit of blurriness for a couple minutes, that's normal too. Okay? So we're going to go ahead and do your eardrops. I'm going to have you lay on your right ear. So if you can just, perfect. Great. So I have his left ear up. I have my medication, and this is my Cipro plus hydrocortisone, Otic drops, and I'm going to warm the med in between my hands first, or place it in warm water, just to make sure it's nice and warm while going in. And this could also sometimes create some dizziness for you, so again, you just want to be careful getting up and down. All right, so I have the right med, I have the right patient, I have washed my hands and placed on new gloves. And because he's an adult, I'm going to pull up and back on the pinna of the ear, drop my 4 drops into his ear, 1, 2, 3, 4, and now I'm just going to gently massage the tragus to allow full distribution of the med. And I'm going to have you just sit there for about 5 to 10 minutes, okay?
Okay.
All right, and while you do that, I'm going to document. Are you feeling okay so far?
Yes, I am.
Okay, great. So, I've now documented. About 5 to 10 minutes have gone by. He's feeling good. I'll have you sit up. Perfect. All right. In any pain, do you need anything at this time?
No, not at this time.
Okay, perfect. So I will give you your call bell. I'm going to wash my hands one final time. And I will come back and check on the patient shortly to take his blood pressure to make sure that everything has stayed stable after administering that patch onto his chest wall. And that's about it. If you need anything, use your call bell to call me.
Thank you.